Hi guys, this is my video on IV starts. I have a willing participant right next to me that's going to let me start an IV. So we're going to take a look at everything that I have and how I actually go about starting the IV. So first I want you to take a look, and I have my IV kit. I have my extension tubing. I have a 10 cc syringe to connect to my extension tubing, and of course I have my IV catheter. So the first thing I'm going to do is put on my gloves. I'm gonna open my kit. And you can just dump it out. It doesn't have to stay sterile. People always get afraid to just dump it out, but you can. And then I'm gonna put this under my arm because under my patient's arm, because as I explained earlier, it's always good to have that little barrier, especially when you're just starting to do IVs. And then I put 2 little pieces of tape over here to have ready. I'm gonna set all this aside. I've got my 2x2s, I've got my tourniquet. I'm gonna open up my normal saline, throw away the trash. I'm gonna open my extension tubing, remembering that I can touch this middle part here. This has a cap on it, so it's gonna stay sterile. This is the side that I'm inserting my normal saline syringe into. So I'm gonna take that cap off. This is where dexterity comes in play again. Gonna get rid of the bubble, and then I'm gonna connect in and flush. And I'm just gonna set that aside and get ready. So then I'm gonna pull my catheter out, and I'm just gonna have this ready to go. So the first thing I'm gonna do is put on the tourniquet on my patient, and it's nice and tight. I'm not nice about this. I make it nice and tight. Just relax your arm down. Thank you. And of course he has a super great AC right here, but he also has a couple right here that you can see. But I'm gonna give it a second. Sometimes I flick it because that helps. Like if you look at how I flick it and it moves it up, it kind of causes it irritates it and raises it a little bit. And then the other thing that I do to help that is use the cleaner. So I can clean the area really well. Okay, have it all nice and clean. Now I'm going to, I just needed to turn it this way just a little bit. Okay, can we see that okay? Okay, so I'm gonna fill right there, and I know that I'm gonna have the pointiest tip of my catheter down. I'm holding it at the sides. I'm not holding it at the top because then I'll end up depressing my button, and then I'll lose my needle. It'll pop back, and then I'll have wasted a catheter. So I'm gonna hold the skin taut, and on this particular one, I can feel like I can go straight in. Often I'll go start off it to the side and kind of work my way in if I feel like they're a squiggly vein. So here we go, 1, 2, 3, there. So you saw how I poked it in, and then I pulled up a little bit and went a little bit further, and I have a good blood return. And now I'm going to just float my catheter in till that gets to that point. Now, if I hold here, look what's gonna happen. The blood's not gonna stay where I want it, right? So I have to hold here, and that will stop the blood. So what I'm gonna do is just clean that up with my gauze. I'm gonna release my tourniquet. I'm going to use my dexterity again to get that disconnected. And this is why I put that 2x2 there, because even as an experienced nurse, if someone's bleeding really well, it'll still kind of come out while you're working on all that. So now and that's why, look, and this has cleaned up all the blood down there for me. I have all that out of the way. So there we go. So the next thing I'm gonna do is I'm gonna draw back blood to make sure that I'm into the vein. And then I'm gonna flush it to make sure that it flushes well. Things that I'm looking for when I flush it, I wanna make sure there isn't any bubbling here, and that it just goes in nice and smooth, and I can push it at a good pace. So I'm gonna then set that there. I'm gonna grab my dressing, which we'll go over another video on how to do this dressing. It has an area right there that isn't part of the sticky part that you can grab on. I put it just on that pink portion. Do you see how it's on the pink part? and then I just lift that up and tuck those two pieces under. Now you want this dressing to be right at where the hub is. So if you needed to change out your extension tubing, you could just take off the top piece, switch it out, and put the dressing back on. So the next thing I'm gonna do is take this off, and that's what this piece is for. It's actually the securement device. So this is I can pull on it right now, and I do okay. And then I can put this on, and I can really pull on it and it's not gonna go anywhere. So that's why if you use these correctly, they work really well. And then it gives you this extra little piece right here where you can put the name, your initials, name, or your initials, date of birth, and the time that you started it. That's when I come and I get my two little pieces of tape because, you know, I'm sketchy like that and I want to make sure I have plenty of secure. So I personally add another piece right there. And then when I'm going to do my loop, I just loop it around there and I put tape over the dressing so that I don't have to put more tape on the patient's skin. And then I am going to clamp it. And there you go. That's how you insert an IV.